Hormone imbalance is a common health issue that affects the whole body, including all the principal organs. What if the same hormone responsible for managing your blood sugar could also determine the fate of your brain? Imagine this. Alzheimer's disease, the most common form of dementia, isn't just a neurological condition, it may actually be a form of diabetes that affects your brain. It's called type 3 diabetes, and it's a silent epidemic that could be sabotaging your memory, focus, and cognitive health, without you even knowing it yet. But here's the good news, there are ways to protect your brain. Stay with us as we explore this hidden connection between diabetes and dementia. Welcome to Levitas. What is type 3 diabetes? Type 3 diabetes is a term used to describe the link between insulin resistance and Alzheimer's disease. While type 1 diabetes is an autoimmune condition and type 2 diabetes is largely driven by lifestyle factors, type 3 focuses on the brain. Essentially, it refers to a situation where the brain becomes resistant to insulin, the hormone responsible for regulating blood sugar. Insulin isn't just important for blood sugar control, it plays a crucial role in brain function. It helps neurons absorb glucose, their primary source of energy, and supports neuroplasticity, the brain's ability to form new connections. However, when the brain becomes resistant to insulin, neurons starve, leading to inflammation, oxidative stress, and eventually the buildup of amyloid plaques, hallmarks of Alzheimer's disease. Researchers have found that people with type 2 diabetes are at a significantly higher risk of developing Alzheimer's, highlighting the metabolic link between these conditions. This growing evidence suggests that Alzheimer's could be the brain's equivalent of diabetes, a disease driven by impaired insulin signaling in the brain. Insulin resistance occurs when cells in the body stop responding to insulin. While this condition is well known for its role in type 2 diabetes, its impact on the brain is less recognized but equally damaging. In the brain, insulin plays a vital role in energy production. Neurons rely on glucose, which insulin helps transport across cell membranes. When brain cells become resistant to insulin, they can't efficiently absorb glucose, leading to an energy crisis. Imagine a car engine running without fuel, it quickly deteriorates. This lack of energy in brain cells leads to neurodegeneration, but the damage doesn't stop there. Insulin resistance also triggers chronic inflammation and oxidative stress. The brain, being highly sensitive to these factors, responds by producing amyloid plaques and tau tangles, which interfere with neuron communication. Over time, this results in cognitive decline, memory loss, and other symptoms of dementia. Furthermore, insulin resistance disrupts the balance of neurotransmitters like acetylcholine, which is essential for learning and memory. Without sufficient insulin signaling, brain function deteriorates, setting the perfect stage for Alzheimer's and other neurodegenerative diseases. Can keto help Alzheimer's patient? The ketogenic diet, or keto, is a high-fat, low-carbohydrate diet that forces the body to burn fat for fuel instead of glucose. For Alzheimer's patients, this metabolic shift can be a game-changer. In a brain affected by insulin resistance, neurons struggle to utilize glucose for energy. This is where ketones, which are the byproducts of fat metabolism, come in. Unlike glucose, ketones can cross the blood-brain barrier and provide an alternative energy source for brain cells. This helps to compensate for the brain's inability to efficiently use glucose. Research has shown that ketones not only fuel the brain but also reduce inflammation and oxidative stress, two key drivers of Alzheimer's. Additionally, the ketogenic diet has been linked to increased production of brain-derived neurotrophic factor, or also known as BDNF, a protein that supports the growth and survival of neurons, enhancing neuroplasticity. Some studies have even demonstrated improved cognitive function in Alzheimer's patients who followed a ketogenic diet. While it's not a cure, keto offers a promising approach to managing the disease by addressing its metabolic roots and providing the brain with the energy it desperately needs. Sugar is everywhere in our modern diet, but its impact on brain health is often overlooked. High sugar consumption has been directly linked to an increased risk of dementia, and here's why. When you consume sugar, your blood glucose levels spike, triggering a surge in insulin. Over time, chronic sugar intake leads to insulin resistance, not just in the body but also in the brain. This impairs the brain's ability to use glucose for energy, causing neurons to starve and die off. Moreover, high sugar levels promote inflammation and oxidative stress, both of which accelerate brain aging. Excess glucose also binds to proteins in a process called glycation, forming advanced glycation end products. These advanced glycation end products accumulate in the brain, contributing to the formation of amyloid plaques and tau tangles, both deeply associated with Alzheimer's disease. Studies have shown that people with diets high in added sugars have a higher risk of cognitive decline and dementia. Reducing sugar intake, especially refined sugars and simple carbohydrates, can help protect your brain from the damaging effects of insulin resistance and inflammation. Interestingly, some medications used to manage type 2 diabetes are being explored for their potential benefits in treating dementia. One such class of drugs is GLP-1 receptor agonists, like liraglutide and semaglutide. These medications enhance insulin sensitivity and reduce inflammation, which may help protect the brain from neurodegeneration. Another promising medication is metformin, a widely used drug for managing blood sugar levels. Metformin has been shown to improve insulin sensitivity and may reduce the risk of cognitive decline by promoting neurogenesis, the formation of new neurons in the brain. However, these medications come with side effects. GLP-1 receptor agonists can cause nausea, vomiting, muscle loss, depression, and gastrointestinal discomfort. Metformin, while generally well tolerated, may lead to gastrointestinal issues and vitamin B12 deficiency. It's important to note that while these medications show promise, they are not yet approved specifically for dementia treatment. Ongoing research aims to determine their long-term safety and efficacy in preventing or slowing cognitive decline. What are the best natural alternatives to meds? For those seeking natural ways to protect brain health and manage type 3 diabetes, several alternatives show great promise. Curcumin is the active compound in turmeric, and it has powerful anti-inflammatory and antioxidant properties. It can reduce amyloid plaque formation and improve memory. Aim for 500 to 1000 milligrams of curcumin with black pepper for better absorption. Omega-3 fatty acids are found in fatty fish like salmon. They support brain function by reducing inflammation and promoting neuroplasticity. A daily dose of 1000–2000 milligrams of EPA and DHA is recommended. Cinnamon is a very common spice that can help improve insulin sensitivity and lower blood sugar levels. Adding a teaspoon of cinnamon to your diet daily can support brain health. Ginkgo biloba, known for improving blood flow to the brain, has the ability to enhance memory and cognitive function. A dose of 120 to 240 milligrams per day is often used. Vitamin D, low levels of this vitamin are linked to cognitive decline. Supplementing with at least 2000 international units daily can help maintain optimal brain function. Incorporating these natural remedies can help you support your brain health and potentially reduce the risk of dementia linked to insulin resistance. In conclusion, the emerging concept of type 3 diabetes highlights the critical link between insulin resistance and Alzheimer's disease. Unlike traditional forms of diabetes, type 3 targets the brain, where insulin's role goes beyond regulating blood sugar to ensuring neurons receive adequate energy and maintain cognitive functions. When insulin resistance sets in, brain cells are deprived of glucose, leading to inflammation, oxidative stress, and the accumulation of amyloid plaques, the key markers of Alzheimer's. This connection explains why individuals with type 2 diabetes face a heightened risk of developing neurodegenerative conditions. Fortunately, dietary approaches like the ketogenic diet offer an alternative energy source through ketones, which can bypass the brain's impaired glucose metabolism and reduce inflammation. However, the everyday consumption of sugar worsens this cycle, driving insulin resistance and accelerating cognitive decline. Pharmaceuticals like GLP-1 receptor agonists and metformin show promise in mitigating these effects by improving insulin sensitivity and promoting neuron growth, though side effects remain a huge uncontrollable concern. Natural alternatives to meds, such as curcumin, omega-3 fatty acids, cinnamon, and vitamin D provide great strategies to combat neuroinflammation, protect neuronal integrity, and maintain cognitive health in the face of metabolic dysfunction. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.